Hi, everybody. Dietitian's favorite time of year, National Nutrition Month, but really, anytime somebody talks about food, it's our favorite time of year. Welcome, welcome, welcome to everybody. I was just telling Matthew, I have the place to myself today, so I'm in my living room. You might see my cat jump behind me. He can be a little spicy, so if I feel unsafe, I'll give a heads up to everyone. So yes, welcome to this month's webinar. Our topic is National Nutrition Month, and food connects us. And so just to give a little background about this, the Academy of Nutrition and Dietetics is an overarching membership organization that we belong to as our profession of dietitians. And every year they select a particular theme. And so this year is Food Connects Us. As I advance through the slides when we go through the webinar, I'll talk too, because some of you remember from last year's conversation, the theme was Beyond the Table. And so you might see some information kind of overlap, or it might be a reminder of what we talked about last year. So thank you everybody for being here and joining us. I hope at the end of this conversation, some of the things that you take away are listed here in front of you. Just a little bit of a deeper knowledge and understanding of things that factor in and influence us. And I'll also share some very specific New York City, New York State resources, but also some global things too that I want to share as well, or national and global things that I want to share as well. Some housekeeping things, as I'm sure you heard when you were coming in, the session is being recorded. I think it's being recorded, right, Matthew? And you can always use the chat box at any
Yes, it is.
time. Either Matthew or I will keep an eye on the chat. I usually try to check in, and sometimes I like to engage in interactive discussion. So if you feel like I see some people are putting some things in the chat right now, so I'll pop open the box. Hello, everybody. Hello, hello. And I'll do my best to keep my eye on the chat. But there's also time for Q&A at the end. These webinars usually run about 40-ish minutes or so, so we have plenty of time at the end if anybody wants to dive in a little deeper or ask me anything. Ask me anything related to food, nutrition, health, wellness, whatever I can answer. I'm happy to do so. That said, like I always mention in these webinars, while I am a dietitian, I'm not your dietitian. So please make sure that you're not taking any of what I'm sharing as medical advice. And if you do decide to do any changes or start something new in your wellness practice, that you're clearing that first with your individual personal healthcare practitioners. All right, one of the things I just lost my click there. One of the things I'm going to share with you too is a little bit of a background, a deeper background and understanding of what a dietitian is. But if we've never met before, hello, I'm Dina D'Alessandro. I have a Master of Science. I'm a registered dietitian, or sometimes you'll hear me call myself a registered dietitian nutritionist. You can see all the things that I've done on the slide here. But in addition to National Nutrition Month, yesterday was Registered Dietitian Day. So last year I did this too. I started the first part of our webinar just giving a little bit of a background of what a registered dietitian even is or does. Not everybody knows exactly. And sometimes when I share my introduction slide, you get an idea of who I am, but not the profession as a whole. So I just want to make sure that first of all, we're celebrating and I'm advocating for the value of a dietitian and share a little bit more of an insight. So as you can see here, as far as who we do consider ourselves nutrition experts. We go through a lot of training and very advanced degrees and skills that require us to understand a wide variety of patient populations, chronic conditions, and so many other things, which I'll share with you shortly. We also provide what is known as medical nutrition therapy. So this is what's different from what we do with other healthcare professionals because we take the condition, the disease state, and then we help implement food and nutrition modifications that can help either manage, support, reduce the risk of getting the disease state getting worse. And yeah, of course, we can also help you with just general healthful habits, but really we're qualified in the more clinical setting. We focus a lot on evidence-based practice, so we're always reading tons of research. We're getting a lot of updates all the time. We attend clinical conferences where we learn a little bit more about different things, whether it's disease states, whether it's pharmaceuticals, whether it's food and drug interactions, or new things that are coming out that we just need to be kept abreast of. Again, I'll talk a little bit about why we're highly trained professionals, and we do take what's called patient-centered care. I think was it last month when we did the science of weight, right? I talked a little bit about that too, of having that relationship with your healthcare provider. It's not just me speaking at you, like do this, do that. don't do this, eat less, move more. It's not just about that. It's about you being a patient that plays an integral role in your health outcomes if you are able to access the resources you need to do that. So I share with you what my knowledge and my skill and my expertise is. You share with me your lived experiences and what's going on. And we have a mutual conversation, a mutually beneficial conversation there that I can support and help you overcome some obstacles. And you can take accountability for some of the things, or you can ask for help or resources if you need that. The what? Oh boy, when I look at this slide, I have a bit of a flashback because being a registered dietitian, entering into the profession is, oh gosh, many, many years, blood, sweat, tears, time, energy, money. Oh, money, money, money. So we are mandated now to have a master's degree. That's not usually the case with a lot of our kind of peer level registered nurses. I don't believe need or are mandated to do that. We also have to go through a year long. It's about 1,200 full hours of a dietetic internship where we do what are called rotations. So kind of like a residency in every little nook and cranny of the health and wellness world. So in my case, I did 5 weeks in a research facility. I did 2 weeks in a WIC center, women, infants, and children. I did 2 weeks in a public school. I did 10 weeks in a food service organization, and I did 16 weeks in long-term care. And there was a couple other things thrown in there too. And some of us also have like specialty things too, like sports nutrition or entrepreneurial things, which I'll explain in a second. When we're done with all the training and we finally graduated from our programs, we have to take and pass a national board exam that gives us the credential of a registered dietitian. But we can also do specialty things too. Like I could do a training in lactation consultant or senior, or like I said, sports nutrition. I can be qualified in that as well. We have to maintain every 5 years continuing education units or credits. So that again makes us be relevant and current and understanding what's going on, whether it's attending conferences or writing research papers. I'll share a little too about state licensure. So we have some specific licensure laws and what's known as a scope of practice that we have to adhere to. Not every dietitian works in a patient facing setting. So I work in private practice. It's outpatient. I do telehealth stuff. Sometimes I do on-site stuff and I do take insurance. So if anybody wants to work with me, I can bill their insurance. So when we're doing things like billing people for our services, we do so in an ethical way. We have to maintain charts and notes and diagnosis codes. I mean, if you've been a patient anywhere, you know how this works. You get the bill, the statement of services, what you owe, what you don't owe, what's covered, what's not covered, and that sort of thing. So it really is part of the medical organization. Where can you find us? Everywhere, my friends, everywhere. There are currently, I believe, about 1 million medical doctors. So we're talking generalists across the United States. There's about 2 million registered nurses. Lo and behold, there are only about 112,000 dietitians because of how intense our training is. That sometimes there's some barriers in even becoming a dietitian. So some states, I think in New York, we have about 6,000 dietitians here, but some states have very, very few. So we are sometimes asked to work across state lines, especially in the virtual space, doing telehealth stuff. So on the right-hand side, what you see there, the color coding, I'm a registered dietitian title is nationally recognized, but I am certified or licensed in the state of New York, so I can work in New York, but I could also work in the green states as well. So I could work with somebody in Texas no problem across state lines telehealth wise. I cannot work with somebody who resides in North Carolina or Florida or any of those red colored states there. And the yellowish colored states, they have like there's some policies or things that I have to adhere to, and I might be able to work with some of the people there too. So again, if they don't have enough dietitians in their state, they'll sometimes ask us to work with their patients, but it has to be specific. Now, I could go and get licensed in Florida, but that's a cost and an application process that I may or may not be wanting to do. But I just want to share with you what the deal is here. That also shows you too that the licensure laws in those red and yellow colored states there are much stricter. So even somebody like a personal trainer or somebody who maybe calls themselves a health coach, because I think we've talked about this before too. It's not the same thing. There's not a title protection around certain titles. Like anybody can call themselves a nutritionist, but you're not allowed to call yourself a registered dietitian unless you have the credential and the training for it. So you can't just call yourself a health coach or be a personal trainer in Florida and give people information about food. You have to also make sure that you have the credentialing for that. Otherwise, you could be penalized or thrown into jail or get a fine of some sort, or your business can be shut down. So I share this because, I know we're in New York City, but some of you might venture out to other places, or you decide to move someplace, or you visit other people in different states. And it's always good to know who and what your healthcare professionals are qualified and trained to do. So I want to make sure that's something that's very important for me to share. Where we practice, also practice areas, so many different places. So, you think of registered dietitians. My joke used to be, people think like I just make salad and that's it. And it's not. It's not. It's so much more than that. Quite a lot of things on here. Tying back to that little introductory slide that I showed earlier, so some of the things that I have done and I continue to do, I do work in business and communication, I do coaching, I work in community and public health, I've worked in the past with culinary. I'm currently now, this would be considered entrepreneurial and private practice, although my joke is always, am I an entrepreneur or do I just work 7 part-time jobs? Because it's tax season and it doesn't feel like it feels like I'm cobbling together quite a lot of paperwork right now. I've worked in management and leadership. I've worked in preventive care, wellness, and weight management. I work on campus as the campus dietitian, so I'm in the university academic setting, but I don't work in school nutrition. School nutrition are dietitians who help create the cycle menus and the recipes for schools, whether it's, a charter school or public school or anything that a school be related to. So again, a wide variety of things you could find dietitians in. And this is what I love about our profession, especially since I also oversee and I work with and mentor students and interns that the world is their oyster. If they don't love working in a hospital, they don't have to work in a hospital. They can go and do something else. They can work in research or behind the scenes, or they can work with military people. So there's such a wide variety of things. And I hope that helps also open up maybe your sense of what you believe to be or what you thought a dietitian is and does. When do you come see a dietitian? You know what? Anytime you dang well want to. I really do believe that anybody can benefit from consulting with a dietitian. If it's preventative discussions or a family history of something, or you're just curious because, especially in this day and age when there's so much media information and misinformation going on, to have somebody who is qualified and credentialed to help you clarify some of that, I think is quite useful. I was just telling Matthew, obviously in the way that this is organized with health insurance sometimes can limit some of that. So, as an example, I work with one person, $0 copay. She can see me anytime she wants to through an entire year, unlimited visits. And then another person, $0 copay, but she's limited to 3 hours. And what can I really do when somebody is trying to manage a chronic condition and look at their outcomes and monitor and evaluate them through the progression of managing their disease? So sometimes that's very challenging for me as a dietitian. And of course, the patient then doesn't get the benefit. So the more we can advocate, and I can share with all of you as well to, ask for a referral to a dietitian, even if it's just one and done. So what you see on screen here is just a small example of where we go in to help with people who need our help. Some behind the scenes things. You only ever see that little picture of me on the intro slide and then me doing this and yapping at everybody through this little screen on your Zoom window. But in the past few years, I've captured some little snapshots of, me on my first day of my semester. I usually take a little video or a screenshot of what the classroom looks like and what I'm talking about, and I share that on social media. I am not very active on social media right now, but that middle one, I used to do these little pop quizzes. So any of my followers, I would put little, what's the name of this thing? Or is this true or false? And I would engage the audience in that way. And sometimes I would be asked to do like an Instagram takeover for a school or an organization or collaborate with somebody. And that's always kind of a fun thing. And the right-hand side is, this is an older flyer, but I'm still the campus dietitian. But again, sharing with our campus population, this is a free service that's offered to currently enrolled students. Your student fees are paying for this. Come hang out with me. I'm only there 1 day a week, but I have a packed schedule every time I'm there. And it's a wide variety of people I get. Obviously, when I'm working with all of you, you're of a certain age, but in my Lehman College campus, the median age is about 27. So I've worked with patients on campus that range anywhere between, fresh out of high school, 18 years old, to returning adult learners who are in their 60s. So as a dietitian, I'm not specializing in any one thing, but I'm getting such a wide variety of conditions and ages that really make me feel like I'm benefiting from such a wide variety of people that I get to work with, and I love their feedback. They tell me that I help them, and I do good work, so that makes me happy. I also want to just take a minute here to recognize some of the underserved or underrepresented groups and sharing with you on screen here some of my colleagues across the country who do very specific things. So this is Jessie Wang. She is a Chinese American. She lives in California. She focuses on gastrointestinal management, specifically irritable bowel syndrome. She puts out the best resources, lots of free stuff. And so if you are inclined on Instagram or YouTube or whatever, you can always search for these people and check out some of her resources. This is Kim Rose. She focuses solely on type 2 and diabetes and pre-diabetes, I should say, prevention and nutrition. And I love the information she puts out. She does little daily tips and tricks, and she answers questions that come up to her. This is Kristen, who focuses on older adult nutrition and also caregiving health, caregivers health. Because again, sometimes these populations are underserved. We don't have a lot of people that specialize in particular ages or conditions. This is Zoe, who's a former intern of mine. So she is a registered dietitian, but she is also uh, she is hails from Shanghai. So she covers the traditional Chinese medicine approach, which is more of that Eastern modality. And she's also a global traveler. So I love, love, love when she's visiting all these different unique places across the world as she does little videos and she shares some insights into her finds and the foods. And this kind of ties in what she does, kind of ties nicely what we're going to talk about later today, too, about that connection to traditional cultures and just honoring and respecting the land that provides us with so many good resources. Last but not least, I want to also share Kimmy Singh. So again, this kind of ties into our conversation last month about the science of weight and body composition. Kimmy is a dietitian in a fat body. So she makes sure that she is trying to reduce the stigma around weight. She's been really integral in New York City specifically about some of these discrimination laws or anti-discrimination laws. So she got a lot of things passed through some of our legislatures, and she meets with representatives of our boroughs. And I really am so enamored and impressed by her because she's quite a new dietitian and she's already making such a big difference, especially in our local community. So I hope that's interesting for me to share with you some of my colleagues here who I absolutely adore and love. All right, so let's get to it. Today, like we said, National Nutrition Month, we're going to talk about a whole bunch of different things related to food. I do want to caveat this just as before we go into this that, based on the current state of affairs, everything is always political. I'm not saying anything that's controversial, just by acknowledging some of the information I'm sharing with you, some of the resources and the programs that I'm going to also provide to you today. It's possible that they might be irrelevant in whatever the future holds for us. So as always, I encourage you, engage in your community, make your voices heard, vote, call your representatives, and let's also acknowledge the social determinants of health for people who might not have access to everything. That whatever you feel like you can take away from this conversation, whatever support I can provide for you, please, I hope that that helps you. So, jumping in to a little bit of like a wide view on where food comes from, doesn't just appear on our plates, obviously. It's quite the journey that takes us from start to finish. We're talking about farmers, supply chains, environment, right? Well, I don't know if we do this here, but picking fruit off a tree in the backyard or in different parts of the globe, they have sidewalks and you just like pick a fig off the tree and you can totally eat it and don't have to pay for any of that. So, depending on where you live, how things are grown, harvested, etc., coastal waters, in land fields across the country, every ingredient really tells a story of cultivation, harvest, and the journey or the distribution. Understanding where our food comes from, I think, really helps us gain a deeper appreciation for that. So whether you sit down and say grace at a meal, or you're just now opening your eyes to the different things that are around you, not rushing through your food, and really just having that establishing that connection both on the local and the global level. Something about the global trade too, so we're talking about bringing different ingredients that are not necessarily local to us. So we're talking about things like bananas from Central America, spices from India, and seafood from the Pacific, just to name a few. Really allows us again to experience these diverse cuisines and cultures beyond whatever we feel most familiar. Next up here, the next two slides, because we are in New York City and state, just want to honor and give appreciation to the nearly 32,000 family farms that are in New York that provide not just on the local and national level, but also across the globe. So thank you to our farmers for doing all this stuff to help feed our families and feed our communities. On a more granular level, and if you want to, you can put in the chat here too. I'm going to stop for a second and just jump in. Oh, thank you so much, everybody who's chiming in. Thank you. On a more granular level, how many of you go to the green markets, even if you don't buy anything? Like you cut through Union Square and you check out what's going on in there. You stop at the vendors. Maybe you smell or sample something. Give me a little thumbs up or put us something in the chat if you know where your green market in your neighborhood is, and if you've ventured out to visit one, or if you do your shopping at a green market. Let me know if this is something that is familiar to you. So we have Grow NYC, which is a part of the Department of Health, and they have a variety of maps and places that you can obviously check out for green markets. And in some of those markets, we also have things like the textile, recycling, and composting as well. Next up here, we're going to talk a little bit more deeper into the cultural significance of food, understanding how we have the ways that we express our cultural identity, the different kinds of traditional foods that we eat over the course of our, year or whatever we're celebrating in that sense really helps us with expressing that and also preserves the heritage. Like think about recipes that have been handed down. I joke a lot of times because my mom has a recipe book with handwritten, I was gonna say, I think it's pen or pencil, I don't know. It's the paper is so greasy, it's almost see-through at this point, and there's so many little bits and pieces of paper, but some of it's written by my grandma, who's passed many, many years ago, and when I see that, like, I don't want to, like, turn that into a thumb drive that's an electronic version. I love being able to touch the paper and see her handwriting and just be so, so happy that she was able to create and hand down a recipe that we still use to this day. So think about the way you're preserving heritage or how you might be passing along some of your recipes and some of the things that you created back when you were a child and moving through. It also helps foster community among diaspora populations. So people who've been displaced, now it develops a condition, that's my cat, by the way, a condition where now people feel much more connected in that sense. I'm so happy to share too, this is very relevant to what we're talking about today, that I am currently enrolled in a 6-week virtual culinary nutrition series. So every week it's run by dietitians. So every week there's a dietitian from a particular culture or place in nationally or across the globe, and they focus on their particular heritage and their cultures. And so the first hour is all about the history of their food, and the second hour is them doing a food demo. So it's all virtual. They give us the recipes in advance if we want to cook along, or we could just watch them cooking and then we can make the recipes later if we want to. So we're halfway through the series. We did Venezuela, we did Hawaii, we did Germany. This week I think is Japan, then we go to Afghanistan, and then we do India. So a wide variety of things that I might not have been familiar with. And so I'm stopping on this screen because I love, love, love a few things about this. Number one, if you remember the food pyramid from back in the day, it's now the My Plate image, which I've shared with a lot of you in the past webinars. This is kind of their version of it. So it's like a watercolor, beautifully designed watercolor version of the food pyramid. So if your eyes can see, because it's a little bit busy, if your eyes can see, there actually is a triangular image in that. Within that triangular image, you see kind of the hierarchy of the food groups. You have the more high fat foods on top, like avocado and oils and coconut. On the right hand side up top, you have some of those more highly processed foods like spam and mayonnaise. And then as you go down the level, you have the animal products. And at the bottom, you have that base of really vibrantly colored, wonderfully nutritious fruits and vegetables. The rainbow represents eating the rainbow. That's probably something that you've heard here too about, trying to diversify your diet and get a little bit of everything. Those different colors represent different vitamins and minerals and antioxidant properties that come in to help support your health. And they even have on the very bottom there too some of their equipment. I think what was it, root vegetables? When we did root vegetables was at the end of last year, if I'm not mistaken. We talked about poi, so that's a root vegetable that they ground up and it becomes kind of sticky pasty, and that is a very big staple in Hawaiian food. So they use that mortar and pestle that you see there on the left-hand side. We also have indication of physical activity. So we have someone in a canoe, someone on a surfboard, at the very bottom, someone swimming. And then if you look way, way back, this might be a little hard to see, it kind of looks like faces in the mountains, and that is to honor their ancestors and the hunters and gatherers of their land. So again, they're very tied and very well connected to their traditional, to their heritage, and to their culture and their environment. And again, I don't know if many of us do feel connections like that, or maybe you do, which is absolutely wonderful. Or sometimes we get separated from that because we are in this, mass produced, very energetic, immediate gratification way of living, that we don't sometimes slow down and really honor where our food comes from. So when this person, Sharon, her name was, when she put her presentation on, we were crying through like 90% of the of her sharing with the history and all the things that they've had to deal with in Hawaii. This next one is an example from a dietitian named Carmen Meyer. She hails from Germany. And the thing that I loved about this is, you really look at these different foods and they're kind of representative, obviously, of that particular culture or that ethnic group. But think of how it applies to what you're used to seeing. Like, for instance, on the top left, that's muesli. Okay, that looks like granola or oatmeal. Grain-based dishes are very prevalent across a lot of different places around the globe and a lot of our own traditional foodways here in America. Sauerkraut and sauerbraten. So we have these fermented cabbage. So you might have eaten coleslaw or kimchi, or maybe you do braised cabbage in your culture and in your foodways. That bottom is an egg noodle dish that they use through like a colander or a strainer to make these like kind of squiggly little pieces called spetzel, and that to me looks very similar to in the Italian tradition. We do something similar like that too with our pasta, like orzo, I think would be the closest thing that I can give as an example. So again, think of all the things that not so much that make us feel different from each other, but what really feels connected and what you can notice as similarities in the things that we eat. And I also want to recognize that, some food habits and some cultures are vilified. So they are attacked because they are quote unquote unhealthy. So the example that I'm showing you here in the Black and brown community, or soul food or Southern eating, people are told that's very unhealthy. You're going to have a heart attack, switch to the Mediterranean diet. But, we've come to understand, again, especially in the conversation we're having today, we want to honor and respect people's cultures. So if you look at the right-hand side, these people are not coming from the Mediterranean side of the world. This is the African heritage diet pyramid. This is no different than what I just showed you in the Hawaiian pyramid or even the American food pyramid. Again, we can't really keep saying to people that generally speaking, their eating habits are bad or their food is unhealthy without recognizing that they have the same bases that we do. So, the traditional American foodways, we don't do a great job sometimes of keeping healthy. And maybe it's because we don't have access to things or we don't understand how food is made. So, wanting to just recognize and honor, again, that hierarchy that they've presented there, basing most of their meals on those plant based items. And again, on the bottom, acknowledging physical activity, social engagement, community building, etc. So, speaking of community building, let's talk about some of these social interactions and celebrations. Obviously, we know about these cultural connections that are made through allowing us to celebrate our traditions, fostering a sense of belonging, also sharing food. Diverse backgrounds, what is this? What is that? And coming together to promote empathy and understanding on a smaller scale. So, this could be something like a food pantry, or I should say a soup kitchen, right? Or in New York City, we have some larger scale restaurants now that are providing more communal seating. For those of you who are introverts, I'm sure it's your absolute worst nightmare to have to be seated next to strangers. But for those of us who might feel a little bit more isolated and want to gain a little bit more insight in developing a community around us, that's kind of cool. You sit down, you go to a beer garden, or you go to one of these picnic table things in the middle of a cafe, and you hang out and you chit chat with people around you. And it really helps with reducing that isolation and making new friends, offering companionship. And there is a psychological benefit of that too, being able to engage in conversation and develop that connection surrounded by meals that's based in meals. We are currently in Ramadan, so I just wanted to acknowledge that as one of the many, many cultural and religious celebrations and ceremonies that we acknowledge. And again, fostering that sense of belonging, allowing you to come together, whether it's a small, intimate family group or going to a larger community setting where, again, you are sharing. And, we're creating memories. I mean, back in the day, we didn't maybe take as many pictures as we do now with our cell phones and stuff. But I think when I look back at some things, like I have a picture of my mom making cookies and I feel like I can smell it. I feel like I can smell the cookies, the lemon cookies that she's making. So being able to think back and hearken, have that love in your heart and that good food in your belly and providing that emotional support for each other. And again, sharing in that common love of food and community providing in those situations. Next up, I'm going to share with you some initiatives, these food initiatives, the impact of things like community gardens, farmers markets, food co-ops through some of our urban and rural settings, and food programs that have fostered also social connections. I'm going to stop on this screen for a second, just as far as categories are concerned of what these food, an example of what these food initiatives entail and what they're trying to focus on, whether it has to do with disease prevention or having more access to underserved communities or financial hardships. Again, integrating the quote unquote healthy food system. So making sure we have quality control and standards of operating. Life cycle nutrition, whether it's pediatrics, breastfeeding, middle stages of life, or the older population. And then also access to quality healthcare. The food initiatives play a role in a lot of those things. I had written down some examples. So we have things like breastfeeding in the workplace. Like these are programs that were initially integrated to make sure that we were able to accommodate breastfeeding people in their work environment. Child nutrition reauthorization, especially in the WIC program. So if any of you have children or grandchildren, 0 to 5 years old, the WIC program provides support, both financial and also food wise, to make sure that in those critical stages of life that the child is being supported. Expanding access to diabetes self management and training, so again helping with pharmaceuticals to be affordable, offering ways to show people how to do their finger sticks and provide people with addressing any barriers that are identified and helping them manage their diabetes diagnosis. Again, these are just one of many examples. The farm bill, I think the farm bill is still around. The farm bill, which determines not only what farmers grow, but also what's available in our food supply and different kinds of policies that help support the standards of that as well. To be a farmer is quite arduous and quite expensive, so they have to go through a lot of applications, and equipment is very, very pricey. So making sure that we have the ability to support them too. Licensure and professional regulation falls under this too. Just like I shared with you earlier, as a dietitian, I want to make sure there are certain protections both for the consumer, you as the patient, and me as the provider, of what I am legally able to do, that I'm not crossing any boundaries, and that I have support through things like health insurance to reimburse for services to make it more accessible on a broader scale, and Medicare coverage is part of that too for some of the services that we provide as well. On the next slide here, you may recognize some of the logos that I've decided to share with you today. Some of these are local, like Hunter College is a local food policy center within the school. They have, you can sign up for their newsletter. They have so much information. They do virtual and in-person conferences as well, just a wide variety of collection of information and research-based information too, of sharing and disseminating information around that. Just Food and Meals on Wheels, I believe, are national. So again, we're talking about being able to provide access to food or quality food at that point too, and making sure there's sustainability in that sense too, supporting not just the health and the wellness of our residents, our human population, but also the planetary needs as well, the environment. Just Say Yes. I think that's just New York. I think New York City has something called Stellar Farmers Markets, and they provide students and interns with paid opportunities to work like seasonally in the farmers markets, and they have a curriculum and they provide food education. So if you happen to be in a farmers market and you see somebody there with like a little green apron, they're doing a food demo or explaining what the seasonal food item spotlighted in what they're sharing with you, again to give you some guidance and understanding to make better choices when you're at the grocery store, etc. SNAP, which is a supplemental nutrition program. Again, this is the one that I'm going to be a little bit concerned about if that ends up getting cut or underfunded, because that does provide assistance that used to be known as food stamps, and that does provide assistance. Again, it's supplemental, right? You're trying to make sure people have enough in addition to what they already have to be able to manage their health and well-being, especially for children and immunocompromised populations like the senior population too. City Harvest, I did a small internship with them. They rescue food waste. Okay, so last year, I think when we did this webinar and we talked about Beyond the Table, I think that's where we talked about food waste. Does anybody remember, percentage wise, how much food goes to waste in the US? What's the percentage? How much food do we literally throw away, which could technically be eaten? Like, it's not rotten or anything like that, but or maybe we let it expire because we don't have something to do with it, or it's ugly and it doesn't look pretty when we put it out in our grocery store displays. If anybody remembers, you get bonus points and the gift of knowledge. That's all I can give to you as a prize.
35%.
It's more than that. It's almost 50. It's almost 50. That is horrifying. So
No.
City Harvest is one of the organizations that goes around and picks up food that's left over at the end of the day from different local pantries, organizations, and redistributes it through the city. So they'll take like from a restaurant and they'll bring it to a food pantry, or they'll bring it to a community health center or a community center or a soup kitchen, as an example. So yeah, it's quite a lot. It's very, very uncomfortable to acknowledge that that's how much food we toss. That middle one on the bottom, World Central Kitchen. You might have heard of Jose Andres. He's a very well-known chef. He has a couple of restaurants here in New York City. He has the Bazaar on West 28th Street, and he has something called Mercado Little Spanish in Hudson Yards up in that Midtown 30s area, which is a Spanish market with like kind of food court setting. He's single-handedly with obviously, his helpers, his chef and food aid helpers, is making and distributing food across the planet. Like, he was in Puerto Rico right after that flood storm that happened a couple of years ago, and then he was, unfortunately, they had some situations where a couple of them were killed in providing aid. So he is doing a heck of a lot of good in this country and across the world too. So again, I share this with you. Just, I mean, you hopefully want to learn this, but if you're curious or you're interested in volunteering for something or receiving information or donating to places that are in support of some of the things that you feel are really important when it comes to food and food initiatives, this is a great place to start. At the very least, you can sign up for their newsletters and see what they're doing and learn a little bit more about them on a more detailed level. The role of food in our social movements, about how food is used to bring attention to social issues and mobilize communities. So, here again, tying into our last year's conversation about the sustainability and the ethical ways that not only the food is grown to protect the planet, so we're not destroying things with toxic chemicals, but also how people are treated, to make sure we have that acknowledgement of workers that are qualified and given compensation and treated fairly and not poorly. So the logo that I have here to spotlight is Slow Food. I think I attended some of their workshops or something many, many years ago, if I remember. They are a global movement. They work with a wide variety of people, individuals, producers, growers, chefs, corporations, anybody, you name it, around the planet, to focus on those food choices through factors such as biodiversity. So I'm going to explain what that means. Right now, we have three crops: wheat, rice, and corn, that make up about 60% of our food production. And that's lovely. But, we've talked about diversifying our diet. The more stuff we can eat, the healthier our body is, because it's providing a variety of nutrient sources from a wide variety of foods. If you're only eating the same three things, like wheat and rice and corn, over and over again, you really build up a lot of stuff in your system, and then you become deficient in other things. So, as of the research that I'm looking at right now, some of the notes that I made for myself, it says around the world, 75% is a lot, of edible plant species have now become extinct. So people like Slow Food are trying to focus on the future and how that depends of diversity, specifically of plants, but also of animals, because again, there's this ecosystem. This is how we stay sustainable, and this is how we survive the planet. So not tapping solely on just a few minor resources, but diversifying the plants and the crops and seeing how we can integrate, some of those, what are they called? Like those heirloom type of crops, and those and seed distribution and making sure people have a lot more diversity, so we're not just focusing solely on a particular thing that if it goes to rot, that we don't have a backup plan. The next one here that I want to share with you too, I love, love, love Food Tank. Love them. I'm on their newsletter. I think they have a YouTube channel. I keep forgetting her last name, Danielle Nierenberg, I think her name is. She heads this up and she's got a whole group of people that work with her on Food Tank. And so this is also a global nonprofit community that works towards a positive transformation in how we both produce and consume food. So they work with and for farmers and producers, et cetera, but they also go into governmental and research places as well. They work with scientists, academics, journalists, and they also help with collecting funding and donating donations in those communities too, so that they can collaborate on providing those sustainable solutions, specifically for some pressing environment and social issues that we're dealing with right now. So again, if you're interested in learning more about them, you can go to foodtank.com. You can sign up for their newsletter. You might want to donate or volunteer with them. Just, again, being a little bit more aware of the things around us that are not just in our supermarket and in our kitchen, but the larger issues at hand to help with advocating for that as well. All right, how to engage with your food sources and some practical, hopefully some practical ways to connect. I think one of the best ways to connect where your food's coming from is just get out there in the world and just chit chat with people, engage with your food sources directly. So on this screen and the next screen, I have some examples of activities that you can do on your own or with your friends and family, visiting a farmer's market. We talked about that before. Community gardens, right? In the concrete jungle that is New York City, there's like 1,000 community gardens. Anybody wants to chime in? Do you have access to a community garden? Do you actually have a plot of land that you either plant, flowers or edible products as well? Like maybe you do herbs or things like lettuce, kale, etc. Anything hardy like vegetables that you can plant. I believe, depending on what you're doing and how you are engaging in the community garden, you might have to pay a fee to use the plot. But again, if it makes a difference to how you eat and how you have control over your food, that could be kind of cool. But honestly, even something as simple as just reading nutrition labels. And I can't remember the names of this, and I apologize for not having it in front of me, but there were a couple of apps, like, downloadable apps that you can scan a barcode of a food item and it'll connect you with the food brand or food manufacturer's site that shows you what their practices are. Like some of them donate money towards uh, schools, education programs, or they give back to their community in some way. So like for every dollar you spend, they provide a dollar in something else that helps with supporting the planet, the environment, resources, etc. So things like that, I think really help strengthen again that relationship with what we eat, the people who produce it, the cultures that influence it, and maybe help us make more mindful and informed decisions. I'm not perfect, but I definitely try to do some due diligence. Like I've learned a lot about certain companies and organizations that I hope are still remaining legit and valid. And so, again, when we come to like mass production of things or mass marketing of things, I have the great fortune that I can spend a little extra to go shopping at a mom and pop or to go support a local food vendor because I know I can get honey someplace else for $3 less. But you know what? I don't use it a ton, and I really want to make sure I'm giving back to somebody who this is their livelihood. This is what they're basing it on. I don't have it listed out here, but if you've never been, I encourage you also, especially now that the weather's getting a little bit warmer, it's getting a little bit nicer out, maybe go check out some of the local neighborhoods and communities that we have in New York City. We have Little Italy down here in Manhattan. We also have Little Italy up in the Bronx. In Manhattan, we have Chinatown, we have Koreatown. We have Spanish Harlem, which I think goes from like 96th Street to 142nd. Quite a wide variety of things going on in that neighborhood. Down in Brighton Beach, we have Little Russia or Little Odessa, technically it's called, right? So we're talking about recognizing the people as an individual community versus having everybody to assimilate to the more mainstream approach. So listening to the language, checking out their stores, their supermarkets. Little Poland in Greenpoint. We have I always forget to acknowledge Staten Island. I'm so sorry for anybody from Staten Island, but maybe you also have communities or neighborhoods like this specific to Staten Island, but I forgot to write down the Staten Island ones. But in Queens, we have Little Guyana, we have Koreatown, and we have Little India. I mentioned I'm an adjunct professor, but I was also a Lehman College alum. So when I was in my undergrad, And when I taught this class later on, in our 200 level undergrad class, we had a market tour assignment. So we had to, as students, we had to go and do individual field trips to a neighborhood in New York that was not familiar to us. So like I couldn't go to Little Italy, I had to go someplace else. I chose Little India up in Jackson Heights because my neighbor at the time upstairs in my apartment, she's from India. And she was like, well, come with me. I'll take you grocery shopping with me there. And I was like, girl, there's a key food right here. Why are you going up to Jackson Heights? She's like, they don't have what I need. So we went up there on the subway and we came home with like a 20-pound bag of rice and all of these very specialty ingredients that she uses for her own traditional foods. And while we were in Jackson Heights, she took me to a restaurant and a bakery and I got to sample. I mean, I know what Indian food tastes like. I live in the East Village. There's Little India right down the street on 6th Street here. But to come from it from her perspective and for her to share with me where she was growing up, how her family used to engage in these traditions, and then explaining every little thing was a whole different perspective. Like I just really, really appreciated the ability to dive a little deeper. When we were doing it as students, we would talk to the vendors. I'd be like, hi, I'm a student at the college and we have a project. Do you mind if I take pictures and write some things down? I'm supposed to compare some of the foods that you carry here. Can you tell me a little bit about what this thing is? I've never seen something like that before. And it was just such a wonderful way to experience new things, new cultures, new people, and make friends with people as well. Okay, listen, bonus points if you can name what this is. Does anybody know what this is on screen here? It's a very large food item, and I'll explain a little bit too what it is if you've never seen this before. And I'm also going to check the chat while I have a minute. I don't think anybody's chimed in.
It's from South Asia. It's
Uh-huh.
a Doran or something like
So,
that.
so you're thinking of durian.
Yeah,
It's similar in look and shape. Durian is the one that's a little. It has a little bit of an offensive smell to it. But this is jackfruit. Jackfruit is a little bit more um lighter in shape and form. And so jackfruit comes from the tree of the fig slash mulberry family. It is a South and Southeast Asian staple item. It comes from lowlands and rainforests. So you'll see it in places like India, Bangladesh, Malaysia, Australia, Philippines, etc. Inside, when you crack this open, it has like these little pebbles that, well, petals, I guess. They're kind of chunky little nodules that stick out. And you can use it in both sweet and savory food. So depending on the permeability and the things that you're using to create the meal, the recipe from it, you can make it sweet or you can make it savory. So I ate it in a vegan restaurant as a substitute for like a pulled pork taco. So the way that they did it, it almost looked like shredded meat and they put barbecue sauce and stuff on it. It was so delicious. So again, I encourage you, if you've never worked with or tried certain things that might be unfamiliar to you, try out a new recipe, try out a new ingredient. You can buy this also, it's a little hard to get through, so you can buy it already peeled, you can buy it fresh, you can buy it frozen, you can buy it canned, depending on what your supermarket might have available to you. I very much encourage you, check out something unfamiliar, maybe look for a cooking class that focuses on specific cuisines, or do like I did. The thing that I ended up going to, that 6-week series, that virtual one, it cost me like $99, but I get continuing education credits for it, so I'm getting a bit of a return on investment. But some things you have, like, food tours throughout New York that might be free, that might be low cost, that might interest you. Last but not least, as I always do in these webinars, I always ask you to reflect on some of the takeaways. What are things that you want to set up for, if you want to set goals up for yourself? Think of things that you want to start doing. Maybe, as the weather gets nicer, you want to venture out and go start looking at other communities in different neighborhoods, in different boroughs. What are things that you're already doing? Maybe some of the stuff I shared, you're like, yeah, I'm not doing that already. Okay, so I validated that for you. Continue doing it and maybe bring somebody that's never been with you the next time you go to a farmer's market, green market, or a different location in the city. And then last but not least, if you want to add something to that list of goals, what's something you want to stop doing? So maybe that's, stop making mindless choices, whether it's food or purchases, before learning a little bit more about that brand or that manufacturer. And that can help you become a little bit more of an educated consumer and have a little bit more mindfulness in your approach of what you are bringing home with you. My friends, this brings us to the official end of our webinar. So